Good afternoon, everybody. We are live on Facebook with Dr. Q. She's from Family Matters, am I right? Family Matters Fertility Clinic.
Yes.
Okay, I'm always mistaking it, sorry. And she's in Johannesburg. And so today's topic is quite exciting. And I'm glad that we're getting to talk to Dr. Q about this. And she's had so many women actually send her questions. So if you guys have questions on this, it's a big topic because you're always wondering when you go to a doctor and you got fertility issues, one of the first things they actually do is give you contraceptives. And in your mind, just doesn't go, it's not the word you use again for it, but it's like how I'm trying to conceive, why are you giving me contraceptives, that it's not what I want. So it's a big thing, and it's something that a lot of women question, and also what is the right one for us. So I'm going to again thank you, Dr. Q, for joining us here. And I know you're very busy and you take a lot of time out just to come and do this with us, and we really appreciate it. Because again, we just want to educate women going forward with regards to fertility and their health and everything else in regards to it. So thank you again for joining us, Doctor.
You're welcome. I'm glad to be here. Thanks for the invite.
It's a pleasure. It's a pleasure.
Great. So, do I just lead the way and
yes,
talk
please.
about contraception? Or okay, all right. So yes, as you mentioned, that a lot of women will come through and their issue is fertility, and then they find themselves on being prescribed contraception, and it's always like. It's like, okay, it's the opposite of what I actually came for. Now you are delaying me even further, all right? So, and one thing that women need to know, that there are many reasons for women to actually be put on contraception. So they do not only serve a purpose of preventing a pregnancy, but they are actually hormones that form part of treatment of other conditions as well. So most women would voluntarily just go on contraception, mainly for the sake of wanting to prevent a pregnancy. And there's also different types of contraception. If you'd like us to cover that as well, we'll do that should time allow. Yes. But then you find that they are on different types of contraception, and that's the main aim, to not fall pregnant. So when women are ready to fall pregnant, whether they were or were not on any contraception, there are certain indications that, or reasons that we find necessary for us to then recommend a contraceptive, at least to treat whatever condition it may be. For example, there are women that have conditions like polycystic ovarian syndrome, and they may be presenting with a problem of not menstruating at all and not seeing their period. So we may say, yes, it's polycystic ovarian syndrome. They have not seen their periods for 6 months, or the periods are irregular, or just women who come in without seeing their periods at all. So then we may start with maybe putting them on a Provera to try, which is just a progestogen only tablets, to try and establish where exactly the problem is. Because the reason women may not menstruate may be because of the problem that they are having in the womb, or it may be a hormonal issue. So we may put them on hormones to try and stimulate the brain, or fool the brain to say there is a certain hormone that is there, therefore work on the womb. Then when we withdraw that hormone, then the body then starts bleeding. So that's how we actually trigger an ovulation, through using the hormones. So it may be a progestogen only that we use, Or we may also use what we call a combined pill that has both estrogen and progesterone. And that also does the same, and it goes and sends a message to the brain that there's enough hormones. And then when you stop that hormone, that's or reduce the hormone, then that's when the body starts bleeding. And then that's what we take as the beginning of a cycle. Also, even when we're treating for things like insemination, when women are going through fertility treatment for times like for insemination and for in vitro fertilization, that actually helps again to have a start point where the cycle is initiated and regulated. So for women who also have irregular cycles, contraception is given to regulate the cycle, because the dosages of the hormones in the pills are mimicking the natural body's hormones or response, to try and mimic the natural cycle. And you find that's why we say start on this day or where the pill is, and then we give you arrows, and then there's different dosages of the drugs according to the timing of the month or the level of the cycle. So it actually mimics your cycle. Then you go on a fake cycle, and then you bleed. And then that gives us a start point to say, okay, it means the womb is actually fine. The lining of the womb is okay. You can build up a lining of the womb, which becomes a cushion for the baby, and it can break off, meaning your womb is responsive. Therefore, we can now go ahead and start this type of treatment. So it's women who have PCOS. Other women are put on contraception to actually treat ovarian cysts, because then again, it's all a hormonal issue. We give the hormone exogenously or externally. Women take in an external hormone to try and regulate the brain hormones, to tell the ovary to produce and then get rid also. I'm trying to put it in simple terms.
Yes.
To get rid of these ovarian fluid collections that are there. So they can come in and we find that there's a cyst, and then we put them on contraception so that the body can actually start the cycle all over again and get rid of the cysts. Other women that are put on contraception are women with endometriosis. So with endometriosis, they feel a lot of pain. They sometimes also cysts. So they can be given medication, mostly first line, it's tablets called Visan. So women will probably relate to that name, women who've been on Visan. And that also has shown that over some time, it can also reduce the size of the cysts or fluid collections in the ovaries. But it does have a hormone in it that then prevents falling pregnant or prevents pregnancy. So we then look at the time frame also that it takes. We say we need to treat you at least for 3 months or 6 months or whatever on this drug, or because you have a cyst, let's give you contraception for a month and let's see where the response. And when the cyst is gone, we are able to start treatment. Because then these cysts, if we try to continue with fertility treatment with these cysts, they can also hinder the growth of other follicles or other eggs. Then we end up being unsuccessful. If you're going through IVF, it can give us a false impression of a follicle that is grown, whereas it was an abnormal cyst that has been there. So we need to make sure that when we start on IVF treatment or intrauterine insemination or any, we start on fresh, level ground, on prepared ground, and there's no lingering cysts or other diseases that are there. So those are some of the reasons that women would be put on contraception even when they actually want to fall pregnant. And it's just a way of preparation so that we start on a clean slate and we know exactly when day one of bleeding was, because then we want to mimic the natural cycle. Okay.
Wow. So it's I had it completely wrong. I had no idea this is what it is. So I completely understand why women are now put on and understand the hormone thing now. So yeah, thank you for that. I'm actually just going to go straight into the questions There was so
Okay.
many questions that came through for you. And I'm just going to check over on Facebook as well if there's any there. But we have quite a few to get through.
I can just say, whilst you're checking for the questions, that the part where then contraception actually affects fertility is that women must just understand that it is not a permanent effect.
No.
Okay, or contraception does not have a permanent effect on fertility.
Yeah.
It actually, especially with pills, it actually has a short-term delay. It may delay your return to fertility, but it does not have a long-term negative permanent effect on your fertility. Actually, with women being on pills or contraception, they, especially with pills, then they tend not to ovulate. So that actually even protects the ovary, from things like ovarian cancer and so on, because there's not much monthly rupture and ovulation. So women then also, you find them saying, no, I don't want to affect my fertility. I don't want to struggle with falling pregnant. Therefore, I will not go on any contraception. One thing they need to know is, especially with combined oral contraception, this will be things like a patch, using a patch, which you change on a weekly basis, or being on a pill as well. These have a short-term delay or return to fertility. So I would always tell my ladies that, look, if you want to fall pregnant by July and you are on a contraceptive pill, let's say you want to be pregnant by July, then don't stop the pill in July. Give yourself a month to 3 months. And at that time, you must not mind, because it can happen, like 25% of women after stopping a pill, they fall pregnant within the first month of stopping the pill. Okay, and then the periods quickly return to normal. Their first cycle, they are pregnant. Then about 70% of women can take about 8 months. But then all in all, within a year, up to 90% of women that have been on a pill or contraception are able to fall pregnant. 80 to 90% are able to fall pregnant within a year. So it just means that there is that short-term delay. We expect the pill or contraception to wear off between 1 to 3 months. It may take a bit longer for the progestogen-only injections and the implant, where it can take maybe 3 to 6 months for the hormone to wear off your body and for your cycle to return to normal. Then you can fall pregnant. But within 1 to 3 months, you should be able to have your natural cycle back. And for women that have maybe been on an IUD and the intrauterine device, like a Mirena, and they haven't seen their periods for 4 years or the whole duration, then we quickly then put them on a contraceptive pill, because especially contraception that has got progestogen only, which is the injection and the implant and even the Mirena. These ones, they focus on mostly shedding or thinning the lining of the womb. So after long-term use, you find that the lining is actually quite thin, and we need to build up the cushion so that you can start menstruating. So even to repair that as well, we put you on oral contraceptives or a patch, which has a bit of estrogen, and estrogen is responsible for building up the lining of the womb. Need that cushion for implantation and pregnancy. So we can put you on a pill maybe for a month, and then you start menstruating, and then we regulate your period after that. But if you don't get your periods within a year of stopping contraception, then it means there may be some other issues of fertility that we are dealing with as well. And then you need to actually go for a checkup.
Yeah, well, I'm really blown away by the information, Doc, because I had no idea this is how it works. I completely understand. So I'm going to go through some of the questions, and some of them I'm actually seeing you answered quite a few by just on your talk and what you said. But let's, first question is thoughts and opinions on natural family planning, fertility awareness.
Natural family planning is the best option there is. I mean, that's. I'm sorry. I wanted to talk about fertility awareness. Natural family planning. It depends what you're talking about. So if you're talking about timing of ovulation and pull-out methods, you know, different people have got different understandings. It is good if you can master it. Personally, even I fail with natural family planning, you know. I remember I asked a patient of mine, she was in her 20s, she was like 29-year-old, and I asked her, so, and she was a mother of 5, by the way, at 29. And then I asked her, so what form of contraception are you using? And her response was, she uses timing. I'm like, wow, you must be really good and your body must be spot on, hey? So teach me, you know, how does it work? She tells me, no, look, the first 7 days I'm bleeding, right? I'm like, okay, sure. And she's like, okay, after bleeding, then I give myself like 5 days of cleaning, you know, afterwards, and then there's no sexual intercourse. Then after those 5 days where the blood is gone and all that, then I'm ready for sexual intercourse. You know, the timing is correct. And if you really look at that, that's perfect timing. She starts sexual intercourse on day 12, and that's exactly when she's ovulating. And I was like, well, I didn't say that to her, but I was like, no wonder, you know. And then I had to take her through the safe time of having intercourse. But then, even then, you know, our bodies are not always the same, you know, and it can really risky to say, I know, you know, some women can be so confident. I see with the mucus, I know now that I'm ovulating. So if you want the best form of contraception, natural contraception or natural methods are the least effective. I just need to make that very clear. They are least effective. One, because the patients themselves don't understand them, and secondly, because the body is not always on a regular fixed clock. Women think that many women who think that their periods need to come on the same day of every month. My period needs to come on the 15th of every month, and it's not like that. And I had to teach them 28 days. You know, if you have a 28-day cycle, the month has 30 days, so you may menstruate twice in 1 month. You know, and if you have a 24-day cycle, that's too short. So, you know, and if you have a 32-day cycle, you know, 30 days, which is a month, may pass, and you haven't seen your periods. You understand? So that's the least effective method of contraception. And I don't know what's about fertility awareness, but maybe she's talking about ovulation, timing of ovulation. And the best way would be to test your urine and know when is it exactly that you are ovulating, and that's the cheapest way. And then you time intercourse during that time if you want to fall pregnant, or away from that time if you want to prevent.
Okay, thank you, Doc. The next one, does Firmodine protect your uterus from forming fibroids, or is it just an eating lifestyle issue? I think we covered this a bit. Hey?
Yes. So Famodine we don't have a drug or anything that actually prevents fibroids. Fibroids are either hereditary, and it also depends on your age and your race and your number of children, if you have any children. So we don't have contraception that actually prevents fibroids, but there are contraception. Contraception does reduce the heavy bleeding and pain that is caused by contraception. So it's only for symptom control, not for prevention or really treatment of fibroids.
Okay. One of the questions, I think this is, you might get this a lot, or someone saying this is why they don't want to go on the contraceptives, is, can oral contraceptives cause cancer?
Oral contraceptives have the hormone estrogen, and it does not necessarily cause cancer unless, you know, you have certain genes that make you prone to the cancer, like a family history, we call them BRCA1, BRCA2, and other risk factors as well. But then when you have cancer that is sensitive to estrogen, then we recommend you not to use oral contraceptives, just because they are sensitive to estrogen. So estrogen may feed the cancer cells that have that. But if you don't have the history, the risks and all that of cancer, then that will be no for things like breast cancer. And then, as I said, it helps with the prevention of ovarian cancer, actually.
Okay, that's great.
Yeah.
Okay, I'm just gonna, what are the disadvantages of having an implant?
Disadvantages, okay, we can maybe also call them side effects then. An implant lasts for 3 years. For those who don't know, it's a small matchstick-like contraceptive that goes under the skin. We usually put it in the arm, and it lasts for 3 years. It has got progestogen only, so it does not have estrogen. So as mentioned, then progestogen helps in the shedding of the lining of the womb, so the lining of the womb becomes quite thin. So most women will then experience side effects of irregular bleeding or spotting continuously when they are on an implant only. And some women will actually not see their periods at all. So, and that's a good side effect for others. There are women who they need to see their periods every month, but there are others who say no pads, no stress, no bleeding. So it can take away your periods completely. Some women would actually complain of decreased libido. The thing about the implant and the injection is that they are systemic. They don't only work in the womb. So when you use them, they go into the bloodstream and they affect your whole body. So some women, not everybody, so some women will actually have a decreased libido or complain of vaginal dryness and all those side effects. So then that's when they need a bit of estrogen. So if they have irregular bleeding or whatever, then we'll put them on a pill for a couple of months for their body to rebuild their estrogen supply, and then they can actually continue on the implant. So it depends. A side effect like not seeing your periods could be bad for somebody and good for others. So it could be a side effect for somebody or a disadvantage, and then it can be an advantage for somebody else. So it depends. Half full or half empty.
Yeah. Option, is what I'm just going through the different ones.
Okay.
And next year, which conception is
There's another question here that says, is there a contraceptive for different blood types?
Yeah.
Unfortunately, there's no evidence for that. So we don't give contraception according to blood type. That's not scientifically proven. And then I don't know if you have the one that we are planning for baby number 3. Will it delay us when we are ready? So I'm not sure what exactly she's asking for, but I think the contraceptive delay, as mentioned, is 1 to 3 months. That's more the natural one. And then you can stop it 3 months before you are ready, so that by the time you are ready, and if it happens, it can be 1 month after you stop, up to 3 months.
Yeah, I'm actually trying to go through it and see which ones you covered already in your talk. So, which is next is which contraception is the best to use? Least side effects when you have fibroid history.
Okay, which side effects is best to use when you have fibroid history? With side effects of pregnancy, I'm sorry, of contraception, I must say that, you know, when there are certain side effects, it does not mean that every woman will experience those side effects. For example, weight gain.
Yeah.
There are women who can take an injection and then they get water retention, which then manifests as weight gain. But there are women who can go through an injection and actually still be fine. So not every side effect that you read will be experienced by you, but some of the things, especially with contraception, I always tell my patients, you will never know until you try it.
Yeah.
And you're not forced to stay on it if it doesn't treat you well.
Yeah.
So when it comes to fibroids, we recommend something that is anti-progestogen, anti-estrogen. So then it will be, and again, it does not, contraception does not treat fibroids, but it treats the symptoms of fibroids, which are mostly heavy menstrual bleeding and pain. So then that will be being on an injection and sometimes even an implant or a progestogen only pill that will then reduce the periods. The problem with using an intrauterine device is that the fibroid can be sitting in the cavity and then that distorting the cavity and you can't even put in a loop. So it's mostly then just injections.
Yeah. There's another one that says, is a vasectomy. I'm not so sure if she's saying what she's asking, but is a vasectomy an option? I'm tired of copper IUD and heavy periods. So that's obviously if she's ready not to, she doesn't want to have any more kids, or then your husband could have.
Then I think she probably used the wrong word of vasectomy. Vasectomy means is done on a male.
Yes.
Where we then cut the tube or tie the tubes of the male. Maybe she meant sterilization for her. Yeah. So there's also a belief that women have that when they sterilize, then or which is cutting the tubes, the fallopian tubes.
Yeah.
Or as they put it, tying the fallopian tubes. And then they have this impression that they are tied. When you want to untie them, you can go back and untie them and go back to your fertility. But it's not like that. A sterilization is a permanent procedure. A vasectomy, cutting the tubes of the male as well, is a permanent procedure. We'll rather say it's irreversible, even though with current technology, there is a certain percentage, a low percentage of success, but and again, it depends how the sterilization was done. If they sterilized you and they took out the fimbria or the end of the tube, or you've got less than a 4 centimeter tube left, then you can't naturally fall pregnant again. We cannot reverse it. But if a long length of tube was left and it was only cut in the center, then we can join the tubes. But it's a very expensive procedure, such that once you sterilize, then the best way of attempting a pregnancy will be through in vitro fertilization, where fertilization takes place in the lab. And then the IUD, if you have an IUD, I take it that maybe the woman has a copper IUD, because she says she's got a heavy menstrual bleeding. Then maybe we can recommend, if she still wishes to fall pregnant, then we don't recommend vasectomy, we don't recommend sterilization. Then the loop is the best option, but she should consider a loop with a hormone. And that one is the Mirena, and that one is actually recommended for heavy menstrual bleeding. So she should consider going on a Mirena to treat the heavy menstrual bleeding. But if she still wants to have kids, she must not sterilize and she must not get her partner to have a vasectomy.
Okay, I'm going to do 1 or 2 more questions because we're going quite a bit over. Is it true that being on a diet or drinking green tea can cleanse them out of your body? So the contraceptives, obviously, because that's something we get a lot. It's like, how long is it going to take me to fall pregnant? It's been 3 months, been 6 months.
Yes. Okay, going on a diet. Look, the body needs to wear them out, and it's just a function of your liver and good functioning of your system. So if green tea is going to make your liver work better and your kidneys work better, then so be it. It's not a problem, but it's a systematic thing where it has to just wear out through natural means of cleansing out in your body. And as I said, it's just a matter of time, 1 to 3 months, then it's cleared.
Okay. Another one is, Okay, morning after pill. Okay, so there we go. People say morning after pill can cause ectopic pregnancies. Is this true?
No, the morning after pill actually works mostly at preventing the implantation of the embryo. It depends also when exactly did you take it. But then if it was before fertilization or before ovulation, it will then delay ovulation and therefore you don't get any fertilization. So there will be no pregnancy forming. So if there is already an ectopic pregnancy, then it means that that morning after pill did not work exactly, because it has to prevent the pregnancy from forming. And also if pregnancy reaches on the even the level of the womb, then it should actually prevent the implantation. Okay.
I just want to have a look if there's anything on here.
The last one maybe I can read out is,
Yes,
how do you
please.
know which one is suitable for you? So to know which contraceptive, you wouldn't know much as to what contraception is suitable for you. This is the reason why contraception is not given over the counter, because contraception can be really, I don't want to say dangerous medication, but depending on your history. So what we have as doctors, so you must get contraception prescribed to you by a doctor who goes through your medical history as well, because we have what we call MEC, the medical eligibility criteria. So we look your age, if you are more than 35, if you have hypertension, if you have a history of smoking, if you are obese, if you have blood clots, a history of blood clots, and all those things, they actually come together and inhibit or reduce the chances of other women taking certain contraceptives. So that's why it needs to be prescribed by a doctor, and you need to give the doctor all these things. We need to look at your body mass index and look at your history, because estrogen also tends to cause or worsen blood clotting. So if you have a history of a blood clot or DVT before, then you are not recommended to actually go on contraception, because then your blood may clot. So we go through that criteria, number one. And number two, we look at, what is your problem? Why do you want to go on contraception? Is it only because you want to regulate your periods? Is it because you have heavy menstrual bleeding, therefore you want to reduce or have lighter periods? Is it because you want to just prevent a pregnancy? So, and there are other benefits of contraception, and that's how we choose as well. If you have lots of acne, we choose contraceptive tablets that can have skin benefits, or reduce your flow, or reduce the pain that you feel during your periods.
Okay. I'm sorry, but there's like 2 or 3 questions on the Facebook side. Doc, I'm on the pill triphasal and I have a low libido. Would you recommend you find something else?
Yes, we will. Triphasal actually has a high dose of estrogen, you know. So maybe if she finds something that is a bit lighter, that has got 15 to 20 micrograms of estrogen, that could work. Or then try other methods as well. If she will be reliable on on a condom, she can even just for a while, just to assess her body, stop the contraception and go on a condom, or go on a copper IUCD, or even a Mirena IUCD. And then that way there's nothing systemic that is, or hormones that is going through her body. Then she can see if it's really related to the contraceptive, or are there other issues. Even the relationship itself can actually cause a low libido. So there's a lot of things.
This is true. Okay, my absolute last question is, would you recommend Zoladex as a treatment for endometriosis?
Yes, we would recommend Zoladex as a treatment for endometriosis, but not as a first line treatment of endometriosis. And it also depends if you still want to be if you're going to be operated or not. So yes, endometriosis, Zoladex is part of the treatment options for endometriosis. And it can reduce the size of the endometriomas or the cysts in the ovaries and the implants as well.
Wow. Okay. Well, thank you, Doc. It's been extremely informative, absolutely informative. I had no idea this is what it does. The reasons for the different types of contraceptives. So ladies, if you have any questions, you can also email Doc. You can email me directly, or you can actually visit Doc's webpage, the Family Fertility Matters. And I'll be sharing all of this on the different platforms as well. So you can contact Doc directly. And if you want to maybe make an appointment and see her. So thank you again for taking your time out, and definitely hope to have you again on Instagram and we can take this further. Okay. Thank you very much. Have a great weekend.
Thank you.
Thank you. Bye.